You're listening to Health Professional Radio. My name is Wayne Buckler. Today I'm joined by Nehemiah Richardson, the General Manager of NAB Health. And Nehemiah joins me today from Western Australia. Welcome to Health Professional Radio, Nehemiah.
Yep, thank you very much, Wayne. It's great to be here.
I understand that you've recently published some research that's also tied in with the health sector.
Yep, that's absolutely right. And we've recently released something called Health in Focus, Health Sector Insights. And actually every month we have a publication that we put out digitally. So it comes from our website, and you can sign up to an email list if you so choose, called Health View, that covers ongoing developments within health and some of our thoughts around it. But specifically on the report that we put together, effectively what that covers is it talks a bit about some of the supply and demand issues that most in Australian health would be well aware of and are constantly talked about, and in a lot of cases have been talked about for years. It covers some of the issues around sustainability of the healthcare sector in an aging population, and then from our perspective touches on the need for sort of better visibility across the system around sort of key clinical and financial data. The need to focus on enabling patient-centered or patient-driven care, so better enabling individuals to take more accountability and be empowered to take more accountability for their health and navigating the system, as well as it touches on how collaboration is really required across the whole system, across that entire continuum of care, as well as across the funders of the health system, being the government, private health insurers, and government, state and federal, that is, private health insurers, and of course individuals. And then the final piece is how technology innovation can actually help enable this to happen. So it really touches on those macro factors, and then we then look specifically across some of the major industry sectors within health for more specific insights, those being primary healthcare providers and insights and impact, pharmacy, aged care, and acute care.
You're listening to Health Professional Radio with Wayne Buckler. My guest today is Nehemiah Richardson, General Manager of NAB Health, and we've just been talking about some research that's been published by NAB Health recently. And Nehemiah, we often talk here on the radio about what we call the trifecta of tsunamis, chronic disease, the aging baby boomer population bubble, and the idea of the Methuselah syndrome, living longer and longer. Your research has touched on some of those. Do you see any innovations on the horizon that will change the health paradigm significantly?
Absolutely. And can I start by saying, firstly, personally, I don't subscribe to the characterization, the characterizations that we see out there around, tsunamis, unsustainability, almost kind of the woe is me. We're going to blow up as a country because people are aging and it's going to cost too much money. And the reason I don't like that is I look at that and say, that's a very negative view to take, and it's a very it's a negative view to take on an industry and a phenomena that it provides the opportunity for significant prosperity. It provides the significant opportunity for people to age exceptionally well. It provides the opportunity for service providers to actually thrive and create not expense, but create economic activity and services, leveraging off the high quality we have as a system and the number of great individuals and research institutes and business operators out there currently providing services in health to kind of transform our economy from a resources-based one to a services-based one, leveraging a great advantage. If we can become more efficient, use the dollars better, and if we can, turn what could be considered to be a tsunami and a sustainable system into something that's highly productive, helps people to live longer, live better, be more productive, right? Take employment opportunities for longer, et cetera, which then turns into a much more productive economy. Okay, so I like to think about this as saying, what a phenomenal opportunity this country has with the assets it already has and the capabilities it already has in the healthcare system if we can better utilize, right, those assets in a more productive manner and get rid of the inefficiencies, et cetera. Okay, so if you then look at it from that lens, and then you look at what's happening in technology, okay, and when I look at technology, I say, boy, there's one debate that you hear a lot about, which is we have a lot of paper-based information in the system. And then even if we scan it, that's not digitizing it. That you have to actually take it, digitize it for it to be used. Well, now let's not look at digitizing the information up that's already exists. Right now we have the iWatch or we have Fitbit. And then you go to the next stage of the wearable technologies that are being developed, right? So very soon, I think in the next, 3 or 5 years, and you're a technology person, you might think it might happen sooner, I don't know, right? But in the next 3 or 5 years, put aside consumer take-up for a second, a wearable is going to provide real-time information, on, telling me how I'm digesting the lunch I just ate. You overlay that with my demographic information, okay, so my age, my ethnic background, et cetera, all of a sudden, all the stuff around digitizing the old stuff is irrelevant because I'm capturing so much stuff in real time that I can slice and dice demographically, I can slice and dice, across various types of, genomics or anything else. And then I can have an IBM Watson or some other big supercomputer crunching things in a way that is completely transformational for the system and for individuals operating in it. Another thing is payment. So, we'll get to the point where in the Australian environment, through some of the reforms that will come through from RBA, from the Reserve Bank of Australia, around the payment system, where, we're not far from having your mobile phone or perhaps even an embedded device in your wearable that becomes your payment mechanism. Then all of a sudden you can match where I go in the system, what I do in the system, with what I'm paying in the system to whatever, to what actually happens to me on a day-to-day basis that then provides information for experts in the industry to add a lot more value to me as a consumer, and it also enables me as a consumer to be empowered to make all kinds of different decisions. So, for example, we're not far away from being able for an individual like myself to say, I'm here in Perth and I'm not feeling very well, and let's say I'm not in the health business, so I know no one in health, and I'm not feeling very well, and I actually need to see somebody. I can look on my phone and I can see there's 6 GPs within a 1 kilometer radius. My health insurance provider will pay this amount of that if health insurers are allowed into general practice funding, okay? But it'll tell me how much it costs. There's probably a rating system that will tell me the customer satisfaction, the experience that I might have in those 6 different people. And then I'll know right up front what I'm going to pay and the quality of the service, and the final piece, I can book it at my convenience, right? So across all of healthcare, there's technology that's going to enable much more efficiency, much more patient-driven decisions, and actually, hopefully, across that whole continuum of care, given where it's so interconnected, primary to acute, a better understanding of, the cost and efficiency that across the system. And from there, you can start thinking about the amount of transformation that can happen. I think just anyone here hopefully can conceptualize that. And I'll add one other piece, which is it then, because of digital technology, it then means that our system can be the biggest exporter of healthcare services to the world if we wanted it to be.
That's an interesting perspective, isn't it? That maybe we can actually export services remotely in what's seen as a hands-on profession. Nehemiah Richardson, General Manager with NAB Health. The art of the possible is something that obviously occupies a lot of your time, and it's a pleasure to discuss with you. And it's a pleasure to discuss with you what you see happening in the health vertical. Your passion is clear and evident, and I'm sure we'll have lots of listeners very eager to get in touch and engage with NAB Health. How is the best way they do that? Is it a website?
Yes, you can go to the nab.com.au website and just search health, and our landing page will come up, our Health View and our Health Insights will come up, and contact details, for the key leaders in our business, including myself, are there. So you'll see our email addresses as well as our phone numbers, depending on what geographic location you're in, and we're more than happy, to take your call and to do what we can to support, to support people across the healthcare industry.
Well, today we might have managed to spread a little bit of the word about NAB Health and NAB Health, and I certainly can see many of our listeners having an acute interest in your vision for the world. Thank you for your time today. If you've just joined us on Health Professional Radio, then you've just missed a very fascinating conversation with Nehemiah Richardson, General Manager of NAB Health. But the good news is we have a transcript on our website. You can also hear the original audio on YouTube and on SoundCloud. This is Wayne Buckler for Health Professional Radio.